So my work mixes law and science to try and strategically influence food policy in Australia and overseas. Here at the George Institute, we've got a database of the food supply which looks at the nutrient and labelling of around hundreds of thousands of packaged foods. So I analyse that data to look at whether the food industry is complying with current regulations. And I do things like joint advocacy with groups like Obesity Policy Coalition and Choice to try and improve food policy in Australia, to hold the food industry to account for the healthiness of the food supply, and to work with the government to improve food policies. Well, I think that unhealthy diets are a leading cause of death and disability in Australia. So 2 out of 3 Australian adults are overweight or obese, and 1 in 4 children. And excess weight is a really leading risk factor for things like heart disease, type 2 diabetes, and some cancers.
I've had the pleasure of supervising Ali throughout her PhD, and a PhD is a time when you have to do a lot of academic work, but Ali also found time for the translational piece. So, for example, she sat on the technical advisory group for the Health Star rating. She submitted endless reports. She got groups of people together to pitch ideas to the review committee, and what she did really changed what has happened with HSR over the last few years.
So I think one area where food policy has been looking to improve Australia's diets is in food labelling. And my PhD focused on Australia's Health Star rating system, which is a front-of-pack nutrition label. Around 30 countries around the world have one of these labels, and the Health Star rating is among the best. It rates foods from 0.5 to 5 stars based on their nutritional quality, and it will guide consumers towards healthier choices. I think what we've seen from my research is that in its voluntary form, Health Stars are still on less than half of all products, and mostly those that score well. So they're not giving consumers the full picture when they're shopping for products, and we really ask that this system be made mandatory so that Health Stars works for consumers and not just food companies.